Hello everyone, welcome to the final presentation of the week of our life-changing work here at London Dental Specialists. Remember to subscribe to our YouTube channel if you like our videos, and also follow us on Instagram and Facebook. So let's get into today's presentation. I'm going to start by referring you to yesterday's presentation, because I said that the presentation yesterday and today are going to show you two different ways of treating exactly the same problem. And the consideration, what I'm trying to get across are the considerations that we as dentists try and put to our patients so that we can help them make a fully informed decision. So this 54-year-old lady was referred to see me, again, same problem, fracture of the upper right second premolar as well. And here it is, this dark area, this is the x-ray. This dark area you will see is not here. It should not be there. That is a picture of the tooth, and that's really what it looks like. It looks relatively normal. And again, on the inside, you cannot see the extent of the fracture underneath the gum because the dentist has very kindly put a temporary filling material in the way, but it is glaringly obvious. Even on this x-ray, this is the level of the bone, and you can see that this gray or this darker area spreads right to the level of the bone. So it's actually even clearer on this x-ray, the extent of the bone loss. So again, same problem as I said yesterday, and the options are the exact same. Crown lengthening surgery to expose the level of the gum right to the new bone level, root canal treatment and new crown, okay, or replacement with a dental implant. And actually, I fully thought, and the referring dentist also fully thought, that the patient was going to opt for the dental implant. No, she didn't. From her perspective, she needed to satisfy herself that she had done absolutely everything possible to save the tooth, and if that didn't work, she was prepared. She was then emotionally prepared to go for the dental implant. Now, although, and the other thing just to be aware of is that for her, she was fully aware that there's a reasonable possibility, perhaps not reasonable, but it's probably 50-50 possibility that the treatment could fail within 6 to 12 months. And again, she knew that unfortunately in this kind of situation where the extent of the damage to the tooth is already so significant, we would love to treat her, okay? As specialist dentists, we have a lot of skill and experience in managing these very difficult cases, but unfortunately, because of the damage that has already been done, we cannot put any warranties on the treatment. And she just basically said, try your best and let's see what happens. So that's exactly what we did. This is the upper right second premolar, and as you can see, there is no temporary filling in here anymore. If you look at here, you'll see that it's slightly red, and that is because I have cut the excess gum. Okay, I have crown lengthened, and I have exposed the extent of the decay / fracture underneath the gum. Now I know that the tooth down there is not decayed. But what I said to her is the one thing that I am not prepared to do is remove bone there, because if she ends up needing a dental implant, I have to then possibly put the bone back, which makes the treatment a lot more difficult. So we agreed that I wasn't going to remove bone, which is ideally required to get a really good results in this situation. So I cut the gum away and filled the tooth back in. then sent her to Niha, our root canal specialist, who did the most beautiful root canal filling on the tooth. And if you look at the pre-op X-ray, and this is the before root canal X-ray, after root canal X-ray. If this is the tooth in question, these two teeth are the same. Before, after, you will see that this gray area that was here is no longer there. It's all now white. That's because we've done Niha has done the root canal filling, and I've filled the tooth back together, and it's done in one visit, and the patient is ready to go back to the general dentist for a crown, because we've done the difficult bit, and the patient can now go back to the general dentist for a crown. How much does it cost? It cost the patient about £1,800 in total. As I said, because of the severity of the damage in the tooth, we couldn't put any warranties, but we promised her that we were going to do our level best, okay, to get the best possible result in this current circumstances. I have put 2 weeks as a period of time, again, just because it takes about that amount of time for the gum to heal. Well, it doesn't take 2 weeks. It's a single day procedure, and the patient is ready to have a new crown with the general dentist in no time at all. So I hope you can see. I hope that gives you an idea of the two ways of dealing with these teeth where either the decay or a fracture extends underneath the gum. The main consideration is, do I need to remove bone? If I need to remove bone, a dental implant is probably better, okay, in the long term. But we can also save the tooth if you are happy to accept the risk that within 6, 12, I don't know, perhaps 36 months, you might need to be having the dental implant anyway. Some patients are happy to take that risk, some aren't. And we will always listen to you, okay? And as long as we can satisfy ourselves that you have fully understood and been fully informed, and what you're requesting makes sense and is in your interests, we promise to always honor it. If you have any questions, don't hesitate to reach out. And if you would like some of this kind of treatment, either refer yourself directly or get your dentist or your hygienist to refer you to us. We look forward to meeting you soon. Have a wonderful weekend, and thank you very much for listening.